Tonight on Bridge City News, now that officials have declared a state of local emergency, we find out what that means for the city of Lethbridge. There are now 119 confirmed cases of COVID-19 in our province. We have a breakdown as to the areas which have been the hardest hit. And more details have emerged as to how the province is helping Albertans who've lost their jobs because of the coronavirus.
Your nation, your province, your southern Alberta. From the heart of Lethbridge, it's Bridge City News with Hal Robbins.
Good evening. Thanks so much for joining us. Even though the risk of COVID-19 remains low for our region, the City of Lethbridge has declared a state of local emergency. The city closed down City Hall and is asking for everyone to use their online services rather than going down to City Hall. City officials explain how they will still meet the needs of those in Lethbridge now that a local state of emergency has been issued.
We have closed our fire halls to the public. People needing any services from the fire service, they can put in a request and we'll just meet you as required. And again, I just want to emphasize this. People who have flu-like symptoms, they need to contact 811 and or follow the online reporting structure that AHS has developed as you can go through the assessment tool online.
The economic impact of required public health measures will be widespread and significant. Our business community in Lethbridge is already hurting. Economic Development Lethbridge has begun engaging with stakeholders about the formation of a focused YQL Economic Recovery Task Force. I expect more details on this initiative will follow in the coming days. It's essential that we find ways to support local businesses throughout this crisis and throughout the recovery that will follow.
I think moving forward, we just need to be nimble. As we redeploy staff in the necessary areas, we're continually working on that as this changes every single day. People need to be patient, but I'm going to ask that people direct those inquiries through 311 so that our communications folks can be freed up so that they can provide information out to the community.
Mayor Chris Spearman says the city is hoping for more information from the province on emergency funding to ensure city operations can continue to function smoothly during the COVID-19 crisis. Lethbridge Police is adjusting operations to prevent the spread of the virus. For the next 30 days, public access to the LPS front counter is closed. Public access to the Collision Reporting Center is also closed. The CRC will be accepting reports over the phone. Frontline officers will continue to respond to all emergency and priority calls. Lethbridge Police say for non-emergencies, you can call them at 403-328-4444. As we mentioned on BCN, a person in the Holy Spirit Catholic School Division has tested positive for COVID-19. It is an individual who is connected with the Catholic Central High School in Lethbridge. The case is now in the hands of Alberta Public Health. As of late this afternoon, there was no confirmation if it was in fact a student or a staff member who was affected. When Bridge City News reached out to the AHS to inquire if there were any more confirmed coronavirus cases in our city, we were told that they only report on zones and not specific cities. Alberta has 22 new COVID-19 cases with a total of 119 in various zones across the province. Let's have a look at where many of the cases are located. There are 2 in the South Zone, which includes Lethbridge and Medicine Hat. The Calgary Zone has been the hardest hit with 83 confirmed cases of the virus so far. The Edmonton Zone has 27 cases. The Central Zone, which includes Red Deer, has 3. And the North Zone for areas like Grand Prairie and Peace River now has 4 confirmed cases. Now that Lethbridge has its first case of COVID-19, Alberta Health Services is reiterating how important it is to protect yourself from the virus.
Coronavirus prevention for ourselves and for the communities and for our loved ones and our most vulnerable populations. First of all, stay home if you're sick. Wash your hands well. If you develop symptoms, HealthLink is there to support you, and there are options for swabbing in the community to be tested. Another recommendation that really observe visitor signage in healthcare facilities. We are having to limit, again, individuals coming into centres to protect the individuals there so that we can maintain our operations.
The AHS is reminding Albertans who may be feeling sick that before calling 811 to use their online self-assessment tool, which is myhealth.alberta.ca. Albertans will now be able to meet with Alberta licensed physicians through their smartphone. A free downloadable app from TELUS Health called Babylon will allow Albertans to access healthcare information and support in response to the coronavirus anywhere in the province. Albertans can use the service to check for symptoms, book appointments, see a doctor, or get prescriptions, all covered by Alberta Healthcare. Health Minister Tyler Shandro says this new relationship with TELUS comes at a time when our health system is actively asking people to self-isolate. Using this app is an alternative to visiting physicians face-to-face. Social media has been riddled with photos and videos of panic at grocery stores throughout the country, even here in Lethbridge. We've seen people overstocking on food and toilet paper, leaving the shelves empty. We visited 2 local grocery stores to see if this is the case for independent owners. Umami Shop and Urban Growers say that things have been busy, but not chaotic.
People are very kind here. People are actually surprised when I walk in here and how calm it is and how well stocked we are. Yeah, I mean, it's everybody's choice where you stock, but I think you should support local family-owned businesses.
Definitely a little bit lower on our meat. I think one benefit is a lot of our suppliers are local, so that's been awesome. Our farms that provide our eggs, they've been able to do extra deliveries to make sure we still have our eggs. Milk is a little bit tough, but we have our organic milk still coming every week. Same with our meat. Certain things we have been a little bit lower on, but I'm just trying to work really hard to keep our orders up. And yeah, it's been more frequent. I would say it's kind of similar to a Christmas week.
We're donating to the local fire stations here in town. I think we have 3, so we're starting effectively today. We're donating our Vietnamese sandwiches, a variety of everything. And yeah, hopefully that brings them through the day with more energy.
A group of Lethbridge restaurants and businesses that have closed amid the COVID-19 pandemic are donating food and making meals for the city's most vulnerable. Bill Ginther, the executive director of the Lethbridge Soup Kitchen, says he received an overwhelming response of generosity in the midst of the global pandemic.
We're not shocked, we're not surprised that Lethbridge steps up when there's a need, and so what has happened is because numerous restaurants have been asked to close, including, for example, Subway at Park Place Mall. They brought all of their non-perishables to us, so that was a fairly significant amount. But at the same time, the owners came and said, well, can we volunteer? We have nothing to do. So they are coming. The LDS Temple in Cardston brought us about $1,000 worth of non-perishables. Lakeview Bakery heard that we were short on bread. It was not coming in as much as before. They brought us 35 loaves of bread. So that was another huge thing for us. It doesn't sound like a lot, but it is. Lastly, among many others, I guess I should say, but the one I'll mention is also the Keg. The Keg locally on Mayor McGrath closed their doors at midnight. They brought us $2,800 worth of non-perishables. And so we are, I want to say this carefully, almost awash with goods, which is great. We don't have to buy anything.
Ginther hopes the favor will be returned and the public will support small restaurants and businesses in their time of need. The federal government is urging Canadians not to take flights during this time, and travel agents have been hit especially hard because of the news.
We've actually been impacted for the past few weeks because we already had people who were kind of on the fence, not knowing what was going on around the world, and then sort of saying, you know what, I'm not comfortable, we'll just wait. So we already had people who were thinking that they'd put off their vacations, and since it's actually all come to pass, now we've been trying to bring people back and then reschedule or make cancellations for them. It's certainly impacted us. The way that we operate is the tour companies actually provide commissions in the background for us. And so if you don't travel, then we don't get paid. So we've already seen with the cancellations that's been happening. And because we don't know what's going to happen in the coming weeks and months, we're just not making those bookings for anybody right now. So for sure it's going to continue.
I think we've been able to provide some assistance to both those that are trying to get back home, those that have had sudden changes to their plans, and then of course moving forward or needing to make changes that sometimes are, well, the last little bit, you know, I need to make changes in 24, 48 hours and phone lines are jammed, and we've just been fortunate that we've been able to, yes, we are on hold as well, but just have a little bit of different options in how we're able to get through to suppliers and make some changes.
Federal and provincial health leaders are telling the public to self-isolate for 14 days if they're returning to Canada from a different country. The province will be launching measures to help Albertans get through these tough times, including a $50 million boost to those who are self-isolating. Premier Jason Kenney says that will translate to around $573 for each person who meets the criteria for self-isolation. The funds, which are expected to start flowing next week, are meant to be a bridge equivalent to an employment insurance payment until new federal aid begins on April 1st. Other changes include allowing residential, farm, and small businesses to defer utility bill payments for 3 months. Student loan payments and interest would be frozen for 6 months. The government also announced it would defer corporate income tax payments until August 31st, freeing up an estimated $1.5 billion. Kenny says COVID-19 may be sticking around for some time.
I believe there are reasons for hope, strong reasons for hope, that we'll come out of this stronger than ever. But this is going to take some time. And I think Albertans need to start to wrap their heads around that. Our scientists project that the viral infection in Alberta will peak about 4 or 5 weeks from now. That means it will hopefully start to decline in its intensity after that, but still pose a very real threat to public health well into May and then into June.
Our legislative reporter, Tyler Dawson, says when he spoke with Premier Kenny, the Premier made it sound like we could be headed for another recession.
And in Alberta specifically, there was a commentary paper earlier this week saying that we are probably headed towards a recession. Now, of course, we never really finished climbing out of the last one. But yeah, looking at, unemployment numbers spiking, incomes going down, and of course, government revenues going down too because of the decrease in oil prices. And as I mentioned a few minutes ago, Jason Kenney saying Wednesday that this could be the most challenging time for Alberta since the 1930s.
Catch the full interview with Tyler Dawson as we discuss the aid that both the provincial and federal governments are making available to Albertans. That's coming up after Business News. BC's Provincial Health Officer, Dr. Bonnie Henry, is urging cooperation, social distancing, and self-isolation. The province announced total cases of COVID-19 has now risen to 231.
We now have 13 people who are hospitalized, 7 of whom are in intensive care here in British Columbia. 5 continue to be recovered, and we have no new deaths to report. So, as I said, these are extraordinary times, and we took a number of extraordinary measures in the last few days to try and do everything that we can to try and stop the transmission of this virus in our communities and flatten out the curve over the next 7 to 10 days is the critical time. It's sometimes challenging to see what it is today when we seem like everything's fine, but we do know that this virus is spreading in our community.
Saskatchewan Premier Scott Moe declared a state of emergency after the number of COVID-19 cases in his province doubled. The government is also prohibiting more than 50 people gathering in the same place and suspended the legislative sitting.
The declaration of a provincial state of emergency provides our government with powers that include the ability to limit travel to or from a community or a region of the province, and directing that a property or equipment can be deployed to address the COVID-19 pandemic that we are facing. The decision to declare this provincial state of emergency comes following confirmation from the Chief Medical Officer that Saskatchewan has 8 new presumptive cases of COVID-19, and this decision comes on Dr. Shahab's advice. This brings Saskatchewan's total of presumptive and confirmed cases of COVID-19 to 16 cases across the province.
Ontario Premier Doug Ford is urging people to take social distancing seriously to help the province cope with the COVID-19 pandemic.
Right now, it is absolutely critical, I repeat critical, that as a society, we're all practicing social distancing and doing everything we can to slow the spread of this virus. We must do everything possible to avoid a situation where we see a sudden and dramatic spike in the number of cases, and as a result, add to the already significant burden on our healthcare system. As the Government of Ontario, we're taking important steps to flatten the curve. That's why earlier this week, we declared a state of emergency.
The province announced earlier today that a man in his 50s who was a resident of Milton was Ontario's second death related to COVID-19. Meanwhile, officials in New Brunswick are urging people to take preventative measures to slow the spread of the virus. The province's Chief Medical Officer of Health says people need to stay home to avoid contact with others as much as possible.
As all of New Brunswickers are aware now, the spread of COVID-19 coronavirus is a serious health threat. It is a global pandemic which is being fought on many fronts, but the most important one is in each of our homes, where we have the opportunity to slow the spread of the virus, reduce the illness, and save lives. New Brunswick is not immune to the spread of the virus. As of today, we have 11 confirmed and presumptive cases, which includes 3 new cases identified in the last 24 hours. If we're all following these practices and playing our role and taking this very seriously, our responsibility, our civic duty, we can flatten the curve.
Prime Minister Justin Trudeau says the border between Canada and the United States will likely close tomorrow, and social distancing measures could last for many more weeks, even months.
We are going to continue to follow the best recommendations of experts. We've heard anything from weeks to months. We know this is a difficult and extraordinary time in which Canadians are taking difficult and extraordinary measures, and we will continue to do that until Canadians are safe. We are continuing to work on the fine-tuning of the agreement between Canada and the United States. I think it's almost there. My understanding is that the measures will probably come into place in the night between Friday and Saturday, so in about a day and a half. As we've said, we're going to work very, very hard to bring Canadians home. It's time for Canadians to come home from around the world. We recognize that that will be a challenge. That's why we sent out a text message to all Canadians overseas with information on how to share their situation and get in touch with consular services. I spoke yesterday with the heads of our 2 large airlines, WestJet and Air Canada, to talk about how we can work with them to ensure that there are flights to bring Canadians home.
Federal Health Minister Patty Hajdu and Dr. Theresa Tam, Canada's Chief Public Health Officer, provided an update on the COVID-19 outbreak, along with new testing options being deployed on how to slow the spread of the coronavirus disease.
The current situation is constantly evolving, and that's why today we also approved 2 new diagnostic tests, which will enable provincial labs to test even more quickly. As Dr. Tam has said, early diagnosis is a critical component of slowing down the spread of the illness, and Canadians can be encouraged that Canada has been leading in terms of our testing capacity at, I think, 44,000 tests to date. Dr. Tam has the most current numbers.
All across the country, people are looking at different ways to maintain that 2-meter distance by staying home from work and school. But sorry, no parties or sleepovers. Avoiding public gatherings in crowded spaces, avoiding public transport or go off-peak hours, arranging to have supplies such as groceries dropped off, not having visitors to your home. Use technology to connect with families and friends. And if you are an older adult or have a medical condition, keeping that protective space.
Federal Conservative MP Dan Albus, who serves as the employment critic, says the Liberals' response to the COVID-19 pandemic has been inconsistent. Albus says Ottawa should have done a lot more, a lot sooner.
The Trudeau government's response to date has been inconsistent and often, sometimes confusing for Canadians. There were many early indications that this situation would reach a crisis level. But on several fronts, the government has been slow to act. Just last week, Conservatives asked in the House of Commons if the government would close our borders to protect the health and safety of Canadians. We were told that it wasn't on the table, and in fact it was ineffective. However, this week the government did a complete 180 degrees and closed our border. Minister Bill Blair has repeatedly told Canadians that the government put in place enhanced screening at airports. But we have all seen on social media the accounts of Canadians who returned home from overseas and were forced to wait hours in cramped queues without hand sanitizer or any information about COVID-19 or whether they should self-isolate.
An economic expert says the Canada-U.S. decision to temporarily close their shared border to non-essential travel will not affect the flow of trade between the 2 countries.
There's a lot of families that might have permanent residence on both sides of the border. And so although there might not be an impact on the tourism industry, at least not one that doesn't compare with what has already taken place in the last 10 days, I think that there'll be a lot of families that might not have the chance to visit or connect with relatives that they otherwise might really want to see or even need to see. Canada is by far America's largest export partner, and Canada is also America's 3rd largest import partner. the largest good that does come back and forth between the two countries are vehicles and vehicle components. Many of the large auto manufacturers have shuttered their plants in the last several days, and so even if trade was even more restricted, it might not have an impact on the auto industry.
A strong earthquake rocked Salt Lake City, Utah, and many of its suburbs yesterday. The 5.7 magnitude quake closed the city's airport and cut electricity to tens of thousands.
So here on Magna Main Street, which has a lot of historic older construction buildings, there's about 14 buildings affected by structural damage due to the earthquake. Reports first started coming in immediately afterwards of bricks falling and then pieces of parapet walls and other brick structure collapsing.
Advancements in technology and medicine continue. Scientists around the world are working hard to find a vaccine to COVID-19. Now, what if it was possible to erase traumatic memories from our brains? Dr. Jeff Zwierink is an astrophysicist and senior research scholar with reasons to believe. Jeff says there would be some direct and powerful benefits.
That, I think, is one of the very interesting outcomes of this research, is that it does look like we can actually help people who've been in traumatic experiences and those traumatic experiences drive a lot of how their body responds to things, that we can actually help them dissociate the traumatic response and to be able to live a more healthy, more functional life that isn't driven by the traumatic experience.
Catch the full interview with Dr. Jeff Zwierink discussing the benefits of erasing nasty memories. That's coming up after business news. It was mainly cloudy and a snowy day again today. The clouds should be clearing out very soon, and the temperature should be plummeting. Complete weather details are coming up. We had more snow again today in many parts of southwestern Alberta. Tonight, the clouds should clear out, but we should see a low near -15. Tomorrow, mainly sunny with a high expected near +1. Saturday, even warmer, up to 5 degrees. The clouds and flurries return on Sunday, giving us a high of only 2 degrees. Monday, a mixture of sun and cloud and a high near 9. Tuesday, more snow developing with the mercury dropping to -3. Wednesday, snow mixed with rain and a high near +2. Looking at the almanac, the average high for this time of year is 6 degrees and an average low of -6. The highest temperature on this date was recorded in 2007 at 18 degrees, and the record low, a chilly -21 in 1958. Sunrise was at 7:35, sunset at 7:42. Let's see how tomorrow's shaping up across the country now. It'll be mainly sunny in Victoria with a high of 13. Blue sky and 12 degrees is expected for Vancouver. Mainly sunny and 3 degrees for Calgary on Friday. Just a few clouds and -1 is on tap for Edmonton. Increasing clouds and -5 for Regina. Clearing and -6 degrees for Saskatoon tomorrow. Partly cloudy and -10 for Winnipeg. Expect showers and 16 degrees for Toronto. A chance of thunder showers and 17 for Ottawa. Periods of rain and 13 degrees for Montreal tomorrow. In Atlantic Canada, expect showers and 10 in both Fredericton, New Brunswick and Halifax, Nova Scotia. Rain and 10 degrees as well for Charlottetown, PEI. And in St. John's, Newfoundland, expect lots of cloud cover and a high of 0 for tomorrow. More retailers in Canada are temporarily closing their stores to help contain the spread of the novel coronavirus. IKEA Canada says it's closing its 14 stores in our country as a precautionary measure, but will continue to support its workers with benefits and a paid leave policy. Roots Canada is shutting down its 115 Canadian stores until at least March 31st, while Vancouver-based outdoor retailer MEC is closing its 22 stores until March 30th. Home Depot Canada says it will be restricting hours beginning Saturday and is expanding its paid time-off policy for staff. A sharp drop in energy prices has prompted Paramount Resources out of Calgary to slash its capital spending plan by 45%. It is the latest company to take that step after oil prices crashed due to the economic impact of COVID-19 and a flood of new oil coming in from Saudi Arabia. Paramount has lowered expected capital spending this year to between $185 and $250 million. That is down from earlier guidance of $350 to $450 million. Ford is suspending its dividend to preserve cash as vehicle sales fade due to the COVID-19 outbreak. The company says it is drawing on 2 lines of credit to put another $15.4 billion US on its balance sheet. The cash will be used to offset the impact of working capital after automakers announced plans to close all of their North American factories. Like other companies, Ford also withdrew its financial guidance for the year. Small business owners across North America are continuing to feel the impacts of COVID-19 as their customers are staying home.
We fight for what we believe in, which is each individual's business, and so we're going to do what it takes to stay open and thrive through this, hopefully. We have not seen the traffic that we usually see. People are holding in place, they're following orders, which is great, that's the point of it. But yeah, store traffic's way down. So the impact of this pandemic on the free market and how small businesses operate is going to be felt for a very long time. I think it's going to show people that they have to modernize their businesses, evolve in the marketplace. Just like we can flatten the curve on the spread of the coronavirus, we can also flatten the curve on how this impacts small businesses by doing what you can. And it's not a lot. It's just thinking of small businesses first before you think of the big guys.
Casinos throughout Las Vegas shut down along with other non-essential businesses. This follows an unprecedented order from the state's governor. Steve Sisolak urged residents to stay home to help curtail the spread of the new coronavirus.
Since being here, it's been a little bit of like The Walking Dead a little bit, like there's hardly anyone around. We've been to Vegas multiple times and I've never seen the streets like this. I mean, we totally understand like why, and they're taking precautions, and that's understandable. So, I mean, it's for the health of, and safety of Americans. So we understand.
A normal day in Las Vegas is a full strip, over hundreds of thousands of people throughout the boulevard. Fun, excitement. Right now it's like a ghost town. You don't see a soul, and anybody that's outside is trying to hurry up and quickly get indoors.
As fear grips North Americans in the wake of the coronavirus pandemic, the toilet paper industry is seeing a lot of growth.
A suitable supply of toilet paper in this country if everybody just uses what they would in the normal course of life. But the panic of not having toilet paper clearly has taken hold, and people are buying because of fear and of the unknown, really. Our biggest challenge, frankly, is getting our machines running at optimal levels and training new employees and just getting the business running in an organized way.
Now, here's a look at today's markets.
The markets rebounded nicely today. The TSX was up 449 points of the day to 12,170. The Dow was up 188 points to 20,087. The S&P 500 was up 11 points to 2409, and the Nasdaq was up 160 points to 7150. Oil was up $4.63 to $25 per barrel. Natural gas was up 5 cents to $1.65. Gold was down 25 cents to $14.71 an ounce, and silver was down a cent to $12.11 an ounce. Wheat is at $230 per metric ton. Barley's also at $230. Canola's at $4.64, and corn is at $259 per metric ton. Live cattle were up $3 to $95.10. Feeder cattle were up $4.50 to $117.08. Lean hogs were up $3 to $61.15. And the Canadian dollar was up slightly on the day to $68.93 US.
Recapping one of our top stories this hour, Alberta has 22 new COVID-19 cases with a total of 119 in various zones across the province. For our region, the South Zone, we now have 2 confirmed cases, including a person from the Catholic Central High School who tested positive. Both the provincial and federal governments have come out with aid packages for Albertans. We will explain how that could potentially help you and your family during the coronavirus crisis. Our legislative reporter Tyler Dawson has details next. But first, here's a look what's happening in and around your community.
Here's your Bridge City News community calendar. Woods Home's emergency youth shelter, The Core, helps families struggling with parent-adolescent conflict by providing crisis support. The shelter is open from 5 p.m. to 8:30 a.m. every day. They also offer professional counseling, referrals, and housing first supports throughout the day. For more information, visit woodshomes.ca or call 1-800-563-6106. Big Brothers Big Sisters in Lethbridge is searching for volunteers to mentor children and youth in their various programs. Volunteers commit anywhere from 1 hour a week to 1 full year. They have many kids on their wait list that are looking for a big brother or sister. Make a difference in a child's life and start something big. For more information, call 403-328-9355 or email info.leth@bigbrothersbigsisters.ca. Do you have a heart to serve our community? Streets Alive Mission is looking for volunteers to help serve hot meals, assist with Foot Friday, and help sort incoming donations. Visit streetsalive.ca to fill out their volunteer application or call 403-320-1159. And that's your Bridge City News community calendar.
COVID-19 or the novel coronavirus is what a lot of people are talking about these days, whether it's those who've been directly impacted by the virus to those who are receiving bailout packages, helping us get through those trying times right now. To talk more about it is our legislative reporter, Tyler Dawson, who's also the Alberta correspondent with the National Post. Tyler, let's start off by talking about some of those aid packages from both the Kenney and Trudeau governments. What will they really look like?
Yeah, that's right. So there's an awful lot of stuff that's going on here. And as you mentioned, both the federal government and the province are getting in on this. So Wednesday afternoon, the Kenney government announced basically sort of these one-time payments for Albertans who are unable to work. I think it's about $527. And the idea behind those payments is to sort of tide people over to when the federal government's payments start coming. Now, the federal government's payments are, shall we say, considerably more complicated. They are more targeted in terms of people who've lost jobs. They are being dispersed through existing programs such as employment insurance, such as child benefit credits. It's almost impossible to rattle them all off. It's a really, really robust and lengthy set of measures that are coming in. And the Kenney government basically is saying on their end that there's not a lot that they feel like they can do right now in terms of pulling economic levers. So what they're trying to do is, put in place some safety nets as best they can to try and get people through what are very likely to be some challenging times for the next several weeks, several months perhaps.
My daughter works as a line cook in Hamilton, Ontario, and she lost her job recently as well when the restaurant shut down, so she's looking forward to receiving some of those federal dollars. Now, Tyler, in battling COVID-19, the province has backed down from some changes on physician billing. Tell me more about that.
Yeah, so this was part of sort of the long telegraphed plans to try and reduce physician spending, to try and sort of bring it down in line per capita with what other parts of the country were doing. This is part of the whole McKinnon report sort of stuff the Kenney government was doing that has, like just about everything else, been blindsided a little bit by this outbreak. But the basic gist of it is doctors at the moment can bill about $18 and some cents per 15 minutes with patients. What the government wanted to do was take that 15-minute number up to 25 or something like that before doctors could start billing for overtime. The government has backed down on this. The doctors' associations and stuff have said, look, this is a bad idea. It's going to lead to 10-minute medicine, things like that. And what Tyler Shandro, the health minister, said was, respectfully, we disagree with that assessment of these changes, but given everything that's going on, we'll just leave it as it is for now. And these are things that they'll come back to once the waters are a little less choppy.
How does the COVID-19 crisis really affect non-essential surgeries in our province?
Yeah, so that was one of the big developments this week that I wouldn't say came out of nowhere, but came shortly after a declaration of a public health emergency, that there were going to be suspensions of all non-essential and elective surgeries. Now, there are some exceptions to that. For example, oncology will continue, cesarean sections will continue, but if you're waiting for elbow surgery or something, maybe probably not going to get in. Now, the important thing to keep in mind on that is that Alberta Health Services is going to be phoning people who had these surgeries scheduled to let them know. They're asking people to please don't phone us. They are, as we've heard all week on the news, totally swamped with people inundating the 811 line with concerns about COVID-19. But yes, elective non-essential surgery is going to be just set aside for now in preparation for what's coming. And that sort of leads me to another point that's worth mentioning, is that the measures that we've seen sort of Monday, Tuesday, Wednesday, Thursday we aren't going to know the effect of them for about 2 weeks down the line. And that's because of sort of the incubation period for COVID-19, the 14-day isolation. So, the cases we're seeing now are really the result of what happened weeks past. So we're sort of, Dr. Theresa Tam, the federal chief medical officer, said, we're trying to look to where the puck is going. And so I think that very much explains what public health officials are trying to do right now.
Many cities across Canada have declared a state of emergency, including right here in Lethbridge and on the Blood Reserve. Tyler, the Blackfoot Confederacy has also closed some facilities.
Yeah, that's right. So what we're seeing across the province, really, in all sorts of communities, cities, reserve, everywhere really, is we're seeing closures of many sort of services. So schools, for example, are not explicitly closed. Teachers are still going in, but students are not attending classes. That's the case in post-secondary. That's the case in K to 12. Daycares, kids are not supposed to be going, things like that. Gyms, for example, are being shut down, whether that's your local recreation facility that the municipality runs, or whether that's your super fancy private facility. So all kinds of things being shut down this week because of the outbreak.
Yeah, my gym as well, the Corps Van Ray YMCA here in Lethbridge, which is really
Yeah,
breaks
mine
my
just
heart.
closed.
Yeah,
Such is life. Guess got to start running again, I suppose.
that's right. Yeah, lots of long walks after dinner. Now, oil
Yeah.
keeps plummeting and is now under $25 a barrel. Tyler, the UCP government was banking on around $58 a barrel for this budget. Does this mean we could potentially see more cuts?
That is a great question. It's been interesting because in the last couple weeks, what Jason Kenney and Finance Minister Travis Taves and others have been saying is Alberta's in a precarious position and we need to be cautious of this. And if things go totally sideways, there could be further spending restraint. So that was very much the hint that they were giving, was that there were going to be more cuts. Now, I think over the course of this week, when we look at what the Kenney government's announced in terms of not bailout packages, that's not quite the right term, in terms of funding for individuals affected by COVID-19, in terms of delaying some of the cuts and things like that they were planning on making, it's I would say a little bit hard to square that circle. What they were saying a week ago seems to not be exactly the thing they're saying now, which isn't necessarily a good or bad thing either way. But this budget is done. So depending what happens down the road, we'll see another budget, no doubt. But that has become a weirdly hard question to answer, just because you're seeing quite a bit of spending, quite a bit of restraint, when that did not seem to be what they were telegraphing mere days ago.
What's interesting is that oil being, like I said, below $25 a barrel, many people are saying, well, the economy's in the tank. The only nice thing is at the pumps. I mean, in Lethbridge here, it's around 82 cents. Edmonton, I've seen it as low as 68 cents a liter, right?
Yeah, I've seen the gas station by my place is 72, 74 cents, something like that. So, maybe it's time for an after dinner drive like we used to do when we were kids. I don't know.
Yeah. Now, the budget passed recently, as we mentioned, but the opposition NDP was not very happy with Jason Kenney's UCP party. Why now?
Yeah, so it sort of was, I wouldn't say pushed through. The opposition would probably say rammed through on sort of Tuesday night into Wednesday. The government says that gives a sense of stability. So on Wednesday, when Jason Kenney was announcing his sort of aid package, saying these are the greatest challenges Alberta will have faced since the 1930s, which is quite a bit when you consider that the NEP was the 1970s and 80s. He said that this budget being passed, getting it through, provides a sense of stability. People know what funding is going to look like, what program spending is going to be like. So that, I think, is sort of the idea behind getting it through. Now, of course, the opposition was saying when the budget was first released that the projections for oil prices and unemployment numbers were overly optimistic. It certainly would look like they were right about that. Oil, as you mentioned, down below $25 a barrel. Unemployment, I guess we don't really have sort of live unemployment numbers, but I suspect in the next quarterly update we're going to see those have jumped. So, but the budget's passed. It's implemented. I don't know what else to say, really. People, this is one of those things that people are mad about at the legislature, and are maybe making political hay out of. But for everyone else, I think they're probably paying far more attention to what Jason Kenney announced Wednesday in terms of an aid package than they are about, the bickering that happened in the legislature 24 hours previous.
With everything that has transpired in regards to COVID-19, oil tanking, the markets tanking, Tyler, we may be looking at not just an Alberta recession, but maybe a Canada-wide and global recession.
Yeah, that's right. There have been some projections, both really, from some of the large banks saying that that's what we are looking at. And in Alberta specifically, there was a commentary paper earlier this week saying that we are probably headed towards a recession. Now, of course, we never really finished climbing out of the last one. But yeah, looking at, unemployment numbers spiking, incomes going down, and of course, government revenues going down too because of the decrease in oil prices. And as I mentioned a few minutes ago, Jason Kenney saying Wednesday that this could be the most challenging time for Alberta since the 1930s. And as we mentioned sort of off the top of the show, we also have on Wednesday announcements from the federal government some $83 billion meant to float the economy through this time. And Finance Minister Bill Morneau talking a little bit specifically about oil and gas being especially hard hit. So we are certainly not looking forward to a especially rosy economic future right now. But as the governments in Alberta sort of keep saying, that we don't have a great idea how long this is going to go on for. So it's sort of hard to predict what the economic consequences could be. But we're also, CNRL, Canadian Natural Resources, cutting some of its spending. But we're also talking about mom and pop shops, about little restaurants and things like that are going to be affected by this too. So it's, this isn't just, oh no, oil prices are down, we might see layoffs in the oil patch. This is also, oh no, I can't go out for a drink. What is the pub around the corner going to do for revenue? So it's certainly a very precarious and risky time economically.
What's really interesting too is one of my friends is a radio announcer, Medicine Hat, and they've actually set up a remote line so we can broadcast right from his home, which is kind of cool, right? Be self-isolated at the same time. But I'm thinking to myself, in TV news, no, we can't do that. There's a green screen, there's camera gear, there's lighting. I mean, it's not quite as easy. I guess for you, maybe you can write from home, right?
Yeah, I can be self-isolated as best I can. My dog is sitting on the couch while I work all day long. So it's all right. But, not even just, I've been thinking a lot about, healthcare workers are getting a lot of attention right now for having to go to work, and grocery store clerks. But I mean, you've got tradespeople, you got plumbers, you've got construction people, you've got police, and man, I think when people put their mind to thinking about it, there's an awful lot of jobs out there.
And mechanics too. I mean, at the same time, if you have to get your car fixed, repaired, right?
Yeah, there's thankfully a lot of these jobs, maybe you're not sort of cheek to jowl with someone and you can maintain your 2 meters distance like the government says, but yikes, and especially for the people whose kids are now off school.
Now, many government facilities have closed because of COVID-19, and the government is no longer doing scrums before question period, but people are still in the house?
People are still the politicians are still going to work, bless them. So far the government is still attending, still arguing with each other. They've got that separation between the sides of the parties in the legislature, so at least that's something. And government workers mostly going to work still at this point. This has been a little small point of, I wouldn't say small, that's not quite fair. This has been a point of contention this week in some quarters where people are saying, businesses are sending their folks home to work in isolation. Why are government workers still going in? And it sounds like the government is in discussions with the civil service in Alberta to try and work around that. But asked about it on Tuesday, Kenny and Dr. Dina Hinshaw, the Chief Medical Officer of Health, I believe is her full title, were saying that, government offers some essential services and we need to make sure that things are still up and running at this point. So that, I suspect we'll see developments on that in coming days.
And ironically, our Chief Medical Officer of Health, Dr. Dina Hinshaw, herself was tested for COVID-19, but fortunately came back negative. Yeah.
Thankfully, yeah.
Our legislative reporter and Alberta correspondent with the National Post, Tyler Dawson, thanks for joining me today from Edmonton.
My pleasure, Hal.
As our scientific abilities continue to advance, it is becoming possible to erase traumatic memories from our brains. Some believe this has great potential to help, but others, however, who see some ethical challenges with this. Joining me now to talk about it is Dr. Jeff Zwierig. He's an astrophysicist and a senior research scholar with Reasons to Believe. It's an organization which combines science together with faith. Jeff, welcome to BCN.
Enjoy being here. Thanks for the invitation.
You bet. Is it actually possible now to wipe out traumatic memories with technology? And how does that process actually work?
Well, as I understand it, it's not possible to actually wipe out the memory, although we do seem to have the capacity to kind of remove some of the physiological effects. So, for example, if you had a traumatic memory and now you have trouble seeing dogs, if you will, or when dogs come around, you get anxious and very disturbed, you can actually do things to eliminate the response to that, even though you can't wipe out the memory, the traumatic experience with the dog.
Could this possibly help someone who's been sexually abused as a child in the past, or perhaps someone who was traumatized by a terrible car accident?
That, I think, is one of the very interesting outcomes of this research, is that it does look like we can actually help people who've been in traumatic experiences, and those traumatic experiences drive a lot of how their body responds to things, that we can actually help them dissociate the traumatic response and to be able to live a more healthy, more functional life that isn't driven by the traumatic experience.
Now, we form memories each and every day, Jeff, and I would venture to guess that these memories actually create part of our identity, our personality. So why do we really want to mess with them?
You know, that's a really good question, and I think we ought to be incredibly careful about how we do this, because how our mind works and what we think, it's a very complicated process and system, if you will. And so we do want to be very careful about how we go in and manipulate it, because we actually could cause a lot of unwanted side effects if we're not very careful how we do that.
Now, do memories help us decide what is morally right and what's wrong?
I think the standard or a moral code helps us decide what's right or wrong, but certainly our memories play into that because, you know, anytime I'm deciding right or wrong, I don't want to go have to look up a book and remember the code. I actually have it in my mind so that I can remember it. And so if we want to make sure that we don't hinder our ability to recall things so that we can make those decisions in the moment rather than having to always go look things up, if you will.
Erasing a horrible abuse experience is one thing, but would people then use this to erase an embarrassing moment? Let's say they did something at a Christmas party that they're really not proud of?
I can't see that wouldn't be done. You know, this seems like a technology that has great potential, but any technology that has great potential for good can also be used for detrimental purposes. And so if you can erase the bad effects of a traumatic experience in the past, you can also erase the inhibitions that would come from having done something embarrassing, so that even though you remember the event, you wouldn't be embarrassed by it, if you will.
So what are some of the other potential drawbacks as you see them to erasing bad memories?
I think there's just a part of this that we need to be careful when we're working with a very complicated system. You know, I do a lot of work on cars and other things, and I can imagine driving my car down the road and you know, something happens and now there's something flapping inside the car and it's making a really annoying noise. And I could just take a very simplistic approach of saying, oh, let's just go remove that bolt and throw it away. It's rattling around. Well, that bolt probably did something else. And so if I don't fix it right, I'm going to cause other problems. And so that's what I see tinkering with memory. We've got to be very careful that we might be able to do something very good to help people that have very traumatic experiences. And I think that would be beneficial. But if we're just kind of tinkering around with people in kind of the ordinary aspects of life, we could very easily introduce some unwanted effects. And those are going to be very hard to predict ahead of time, simply because the human mind is such a complicated piece of equipment.
Do our traumatic memories maybe serve us in any way? In other words, do we need negative experiences to really learn from them?
It really does seem that. I know a lot of how I behave in a situation is informed by how things have happened in the past. There are things that I just instinctively, it's like my body responds and says, oh, be cautious, be careful here. And so what's happened in the past helps me navigate in the moment of the day, because there's kind of this idea that, well, I'll just kind of think logically and work through everything. And the reality of it is I don't have time to do all that in the moment. And so those past experiences where, hey, this worked well, ooh, this worked poorly, inform me and allow me to make those decisions that I'm confronted with each and every day. And I have to make a decision on the spur of the moment.
So how do we really learn from a bad relationship if we can't even remember it? I'm thinking we're going to be repeating the same mistakes over and over again.
Well, I think that's right. You know, I'm kind of reminded of what the Bible says, that the Bible encourages us to think on the things that are honorable and true and pure and right, because as we do that, we're reinforcing that that's the way we're going to behave in the future. So if we don't have those bad memories, we can't learn from them to avoid them in the future. In the same way that having good experiences help inform us and make good choices in the future. And so I think we just want to be very careful about trying to remove memories. And I will make this comment. As of right now, I'm not aware of any ability to remove the memories are there. What we can do is dissociate some of the physiological effects of, say I'm terrified of spiders. I can remove the physiological fight or flight response that comes with that so that I can make a more informed decision, so that I can think and behave rationally in the moment. I can't actually get rid of the traumatic memory. It's still there. It's just, how does it influence me in this particular instance?
Do we really need the past to give us proper perspective on the present? What are your thoughts?
I think the past is an incredibly important thing. It does help us understand what's going on in the moment. And with memories, again, I think there's this tendency to think of just the memory and that's all that's important. But there's a whole lot that goes into the memory. There's how your body responds. Did you think about it well? Did you think about it poorly? Have you gone back and rethought about it in light of the truth? All of those past things inform what I do each and every moment of every day. And so I think going in and tinkering with our memories and how we respond to them can have a lot of impact, unwanted or unintentional consequences of what may go on in my decision making each and every moment of each and every day.
I heard that there were some scientists who believe that our memories are often interlocked, one memory together with other ones. So maybe potentially erasing one bad memory, would that affect some of the other ones?
I don't see how it couldn't. Again, our minds are very complicated, and what's going on in the brain when you have a memory is that there's new connections being formed, but those connections are connected to other things. And so if we're trying to destroy one connection or remove one memory, that's going to take those connections away, but that's going to have consequences throughout the brain. And again, a lot of the consequences of that we may not be able to predict ahead of time.
Apparently, even though a memory could potentially be erased, our subconsciousness will still retain the emotions that come along with that bad memory. Only now the context of those negative emotions are not there. Do you see that as potentially being problematic?
Yes, it is, because if you've now separated the emotions from the physiological response or the emotions from the event itself, you've got these emotions floating around, but you have no context for being able to process them. I know some people know how to process emotions real well. I struggle with that. And a lot of what helps me process the emotions is being able to think through, remember the events, analyze what happened, and think rightly about it. Well, now if those are separated, I now have no longer any good way of processing those emotions to help them keep from driving my life and make and influence decisions, future decisions, in a detrimental way.
Now, considering that there's so much we do not yet know about how our memory works, is it best to not play God and just learn to cope with traumatic memories?
I think we need to be very careful, and I think to the extent you can cope with traumatic memories using just the tools, like I said, that the Bible talks about, thinking about what's true and honorable and right and pure and lovely, that would be ideal. But what I do see the advantage of this is that sometimes, as try as I may, my head hurts and I can't get rid of it. And so I take aspirin. That helps me deal with the pain so that I can do things appropriately or properly. Well, I do think this sort of therapy would help people who are just paralyzed or unduly burdened by traumatic experiences. It will help them get past the traumatic experience so that they can deal with things in a more healthy way. And I think that's a good benefit, but we need to be careful about using it and thinking it's a miracle cure for every bad experience we've ever had.
Where do you think this field of science will actually go over the next 10 or 20 years?
I'm thinking it will help us understand how the mind actually works. Again, it's a very complicated process of how we think. What does consciousness mean? How do we understand past events? How do we think about future events? How do we feel? And how does that all integrate together? The more we can understand how that works, the more we can actually use that information to help and benefit people. So rather than kind of having it be a black box where I know if I put this little drug in, it does this, the more we understand that process, the better we're going to be able to use it to help people who desperately need the help.
I'm kind of thinking at the same time, instead of removing some of those potential memories, how about implanting some fake memories, like Total Recall, that movie with Arnold Schwarzenegger, redone, I think, with Colin Farrell. How about we plant in a memory of I was in a tropical vacation somewhere, instead of actually paying the big bucks to go there?
Well, yeah, it does seem like there's some capacity to do that. And people who've been involved in this research can show that you can actually convince people they were involved in committing a crime that they didn't actually commit. And so there are techniques and processes, even without using the drugs, brain function inhibiting drugs, that you can use to do that. And so we'd like to think, if I just have all these memories of idyllic environments, that'll be great. But the reality of it is you've got these memories that aren't connected with what actually happened. And anytime we obscure the way things really work, that often works to our detriment. And so while it may seem like it'd be great and a good time, again, that's almost certainly going to have negative consequences later.
Dr. Jeff Zweerink is an astrophysicist and a senior researcher scholar with Reasons to Believe. Thanks for your time today.
Thank you.
On behalf of all of us here at BCN, I'm Hal Roberts. God bless, and thanks so much for watching.